Hello, myself Manjusini. We are started today about the management of breast engorgement. Breast engorgement is a swelling, tightness, and an increase in the size of the breast, usually occur in the early day of breastfeeding, between the day 3 and 5, but may occur as late as a day 9 to 10. Before feeding, to encourage the milk flow. Warmth, to take a warm shower and apply the warm moist towel for the few minutes, and gentle massage. Lymphatic drainage, gently massage or use lymphatic drainage technique to soften the breast and help milk flow, but avoid deep vigorous massage then can cause injury. Express milk, and hand express and pump a small amount of softened and aerole for easily latching. Between feeding, then cold compressions. Apply the cold pack, frozen veggies, chilled cabbage leaf, not to nipple, for 50 to 20 minutes to reduce the swelling and pain. Pain relief, take the ibuprofen, acetaminophen as a directed. Supportive bra, wear a well-fitting supportive bra. Avoid the contracting during the feeding and pump. Frequently feeding. Feed the baby often ensure a good latch to effectively drain milk, and pump moderately. Pump to relieve pressure if the baby is not feeding well, but avoid the empty the breast complete to prevent the oversupply. What to avoid? Vagus massage can increase inflammations, and pumping empty can single your bodies to make the more milk. Sudden weaving soft slowly if you ending breastfeeding. Then medications, pain relief, ibuprofen help in the pain swelling, acetaminophen for pain, antibiotics prescribed for doctor, engorgement development in the mastitis, physical therapies, techniques like a symptoms, warm before feeding, warm compression, shower for 3 to 5 minutes to encourage the let down. Cold after feeding, cold pack, a chilled cabbage leaf for 10 to 20 minutes to reduce the swelling and pain. Reverse pressure softening, gentle pressures around the areole to move fluid back, improving latch. Then next, then feeding strategy can cause injury. The frequent feeding to pump every 2 say 3 hours. Every 2 3 hours. Change the position, alternate feeding position to drain the all breast area. Empty breast, let the baby feed until comfortable. Let down force empty. When to see a doctor if the symptom don't improve within 24 and 28 hours. Then if you doctor fever, chill, या flu signs, and to severe pain and sign of infections. Okay, thank you.